To tell you about the woke world here on the show, and it gets woker and woker by the day. I don't know about you, it doesn't matter whether you're paying for your own private healthcare or indeed on the National Health Service, but whichever you're paying for, it's going to be under their own directive. It's fascinating, isn't it? Because we live in a world now where we're all treading on eggshells. You know that saying, don't say the wrong thing, don't do the wrong thing, or apparently you'll be cancelled. We told you recently, didn't we, about TV shows that they're not allowed to show anymore because, might be too offensive. Even Mrs. Brown's Boys, which is an incredibly, phenomenally popular BBC TV comedy series, they don't like to promote it because it's not necessarily in their remit. But what about in the working practices, the things that you and I pay for, the British taxpayer? Well, over at the NHS, right now they're currently on strike a lot of the time. Nurses are walking out, ambulance men are walking out, even physiotherapists are threatening to go. Line is, there's a lot of sympathy, or was, in fact, for the nurses, particularly through the pandemic. But after this story, it's truly dwindling. And here's why. As you can see over here in the very heart of London at the NHS hospital, that's right. Now, they've decided that they only want to bring in a panel to find out why people are not employing from diversity groups and taking white people first. That's right, discrimination in the United Kingdom. Now, while they're playing this down and the jobs are around about £70,000 plus a year, a lot of people are saying, why is it a one-way street? But more importantly, if you think about it, the NHS going through all of these strikes, of course, alienating the public that pay their wages, seemingly don't know which is the right or the wrong way. Which either way you look at it, right now, sympathy is dwindling on a literally minute by minute basis. But when you see stories like this of a panel, as I say, being brought in to the Royal Free Hospital in London to find out exactly why they're not employing from an ethnic minority background, one has to say just how daft has it truly become. While many people agree nurses should be paid a better salary, along with doctors, and as I also pointed out, the hardworking cleaners, the background staff, the catering groups, really, right now, isn't it the NHS managers that seemingly should go on strike from their own stupidity? As ever, I'd love to know what you think to this particular story in the comments below. Neil Sean in the very heart of Yorkshire.